Hi, my name is Rozan Javadi. I am a mental health practitioner. Today I want to talk about dementia. What is dementia? Dementia is a term used to describe a group of symptoms which affecting your memory, thinking, and social abilities. This kind of disease severely can affect and interfere with your daily life. And it is not just a specific disease, but several diseases can cause a dementia. So, dementia generally involved with memory loss. Memory loss has different causes. However, it is important to understand that memory loss doesn't mean you have a dementia. However, it can be signs and symptoms of dementia. Alzheimer's disease is the most common cause of progressive dementia in older adults, but there are other causes of dementia as well. Dementia causes can be dependent on different type of other disease which may be involved and severely can affect your memory and thinking. What are the signs and symptoms of dementia? Dementia symptoms vary depending on the cause, but common signs symptoms include cognitive changes, memory loss, which is usually noticed by someone who is living with the person, and difficulty communicating or finding words, difficulty with visual and spatial ability, such as getting lost when the person is driving, and difficulty reasoning or problem solving. The person also can experience difficulty with handling complex tasks. Also, the person can represent difficulty with planning and organizing. Also, difficulty with coordination and motor function is other sign and symptoms of dementia. Confusion and disorientation, psychological changes and personality changes, and depression, anxiety, inappropriate behavior, paranoia, agitation, hallucination. They can be all signs and symptoms of dementia. However, you should notice in different stages and level of dementia, you can experience different signs and symptoms. And as much the disease progressing, the signs and symptoms increasing. It's important to understand when to see a doctor. See a doctor for somebody you know. It's important to notice about the person memory problems. And normally other people, when they're living with a dementia person, they notice the person got a memory issues. What are the causes of dementia? Dementia is caused by damage to or loss of nerve cells and their connection in the brain. It's dependent to the area of the brain which has been damaged by dementia. So it can affect people differently and cause a different signs and symptoms. Dementia often grouped by what they have in common, such as the protein or protein deposited in the brain or the part of the brain that's affected the brain area. What are progressive dementias? Type of dementia that progressive and aren't reversible include Alzheimer's disease. This type of dementia is the most common type of dementia. And in Alzheimer's disease, normally people with dementia brain, you can see in the scan or other tests, laboratory tests, and they have plaques and tangles in their brains. Plaques are clumps of a protein which called beta amyloid, and tangles are fibrous tangles, and they're made of tau protein, and it is important to understand that those clumps damage on the healthy brain and neurons can cause just an interruption between connection between neurotransmitter and cause a dementia, or possibly the consequences of that can be problem solving issue or thinking or memory problem. small percentage of dementia is related to three genes, which can pass down from parent to child, while several genes are possibly involved with Alzheimer's disease, which is important to understand that increases risk of, for example, APO4 genes can cause dementia in later life. Vascular dementia. What is vascular dementia? This type of dementia caused by damage to the vessel that supply blood to your brain. Blood vessel problems can cause strokes or affects the brain in other ways, such as by damaging the fibers in the white matter of the brain. The most common sign of vascular dementia include difficulty with problem solving, slow thinking. What is Lewy body dementia? Lewy body dementia are abnormal balloon-like clumps of protein that have been investigated in the brain of the people with Lewy body dementia. The common signs and symptoms of this type of dementia can be acting out of one's dreams in sleep and seeing things that aren't real, and visual hallucination, and problem with focus and attention. Other signs can be include uncoordinated or slow movement, tremors, and rigidity or Parkinson. Frontotemporal dementia is the group of disease which characterized by the breakdown of nerve cells and their connection in the frontal and temporal lobes of the brain. These are the area generally associated with personality, behavior, and language. Common symptoms affect behavior, personality, thinking, judgment, and language and movement. What is mixed dementia? Many autopsy studies represented of a brain who were just 80 years old and or older. This kind of dementia include having a combination of several causes such as Alzheimer's disease, vascular dementia, and Lewy body dementia. Other disorders linked to dementia, Huntington disease, which caused by genetic mutation. This kind of disease caused by certain nerve cells in your brain and the spinal cord to waste away. Signs and symptoms of Huntington, including a severe decline in thinking, cognitive function, skills, and usually appear around age 13 to 40. Also, traumatic brain injury (TBI). This condition is the most caused by repetitive head trauma, and some people, like boxers and football player and soldiers, they may develop TBI during incident they are experiencing. Traumatic brain injury, depending on the part of the brain that injured. This condition can cause dementia signs and symptoms such as depression and memory loss and impaired speech. TBI may also cause Parkinson's symptoms and might not appear until a year after the trauma. Also, Creutzfeldt-Jakob disease is the rare brain disorder, usually occurs in people without known risk factor. This condition can be due to deposit of infection proteins called prions. Signs and symptoms of this fatal condition usually can occur after age 60. Also, Creutzfeldt-Jakob disease also can be because of gene or family inherit. It may also be caused by exposed to diseased brain or nerve cell system tissue. Many risk factors can cause dementia, and they are linked to causality of different type of dementia, such as Alzheimer, Parkinson, or vascular dementia. Some of these risk factors are changeable, but many of them are not. Some risk factors that cannot be changed include age. This kind of risk factor by increasing the age, especially after age 65, can predispose your brain to dementia. However, dementia isn't a normal part of brain aging, and dementia can occur in young people as well. Also, family history as an unchangeable risk factor of dementia can have an important impact in dementia causation, and it can put a person in greater risk of developing this disease in later life. Down syndromes also can cause dementia signs and symptoms, and those people in middle age, during when they get in middle age, and many people with Down syndrome can develop early onset Alzheimer's disease. However, there are many risk factors that can affect on dementia development in your brain, which can be changed, and you can control it as well. For example, diet and exercise. Many research presented lack of exercise increase the risk of dementia. Also, a specific diet it can reduce dementia risk as well. And many research indicated that many people in different part of the world, especially using Mediterranean just a diet, they are in lower risk of dementia, because this kind of diet include rich in whole grains and nuts and seeds and normal vegetables. Also, excessive alcohol use can cause dementia signs and symptoms. Drinking large amount of alcohol has been known as a cause of brain changes, and it can have just a negative effect on brain cells. And several large studies represented that alcohol consumption disorder is linked to increase of risk of dementia, particularly early onset dementia. Also, cardiovascular risk factor. This include high blood pressure and high cholesterol that build up of fat in your artery walls. Also, which can be followed with obesity, also can cause dementia signs and symptoms as well. Depression is other risk factor which it is not been well understood that how it can impact on your brain and cause a dementia. However, late life depression can cause the development of dementia. Also, diabetes can increase your risk of dementia, especially when you're not controlling it with medication. Smoking also can increase risk of developing dementia and blood vessel disease as well. And many researchers presented smoking possibly can predispose your brain to dementia in later life. Also, sleep disturbances is other risk factor of dementia. People who they have just a sleeping problem and a sleeping disturbance, they are or they may be in higher risk of developing dementia. Dementia can affect on your body system, psychological, emotional, physical, and for example. Dementia can cause a poor nutrition in many people with dementia. Eventually, they reduce or stop eating, and those affecting their nutrition intake. Ultimately, they can be unable to chew and swallow the food. Also, dementia can affect on ability to perform self-care tasks. A person with dementia progression can represent difficulty with bathing, dressing, and brushing their hair or teeth, or using toilets independently, and they're taking medication as ordered by a GP or professionals. People with dementia, as the disease is progressing, they can present difficulty with personal safety challenges, and when they want to do day-to-day life or task, they can present a safety issue. And for people with dementia, it can be include driving, cooking, and walking, and living alone. As dementia is progressing, it can severely affect on body movement and physical or emotional or psychological ability, and in the late stage or severe stage of dementia can be result in coma and death, and often it can occur from an infection. There are some strategy which can help possibly reduce risk of dementia in the future. Some prevention strategy for dementia can be included of keeping your mind very active. Mentally stimulating activities such as reading, solving puzzles, and playing games and memory training might delay the onset of dementia and decrease its effects in the future. Be physically and socially active also can help to reduce or delay the onset of dementia and reduce its symptoms as well. 150 minutes of exercise a week can be really helpful to preventing dementia in the future. Quit smoking also can be beneficial in preventing dementia in the future. Many studies presented that smoking middle age and beyond may increase your risk of dementia and blood vessel condition. Using proper nutrition and getting enough vitamin can be very beneficial in preventing dementia in the future or delaying the disease in later life. Many studies presented that low level of vitamin D in your blood are more likely to develop Alzheimer's disease and other forms of dementia. Also, it is important to understand how to keep yourself healthy. For example, manage your cardiovascular risk factor via treating your high blood pressure and high cholesterol and diabetes can be a good idea, just reducing risk of dementia. Also lose weight, and also obesity has been as a great risk factor of dementia as well, can be beneficial to delay or prevent dementia in later life. So many studies represented that high blood pressure can lead to risk of dementia. Dementia can be diagnosed by two methods. First method can be a laboratory test, and other method can be cognitive test. Cognitive test normally can be via different form, which is like a structured instrument, such as the informant questionnaire on cognitive decline in the elderly, IQCODE, or the functional activity questionnaire, FAQ. This kind of assessment is beneficial to understand the person's cognitive function and memory level. Also, to understand if somebody is suspected to dementia, normally the professional or GP are asking about cognitive ability and the person behavior and psychological symptoms of dementia. Also asking about different factors that may trigger the dementia sign and symptoms, which can be like an infection or vascular disease. Then want to identify or diagnose a person with dementia, ask for a family history of dementia, and using, for example, consumption of drugs, alcohols, or some medication which can cause some sign and symptoms of dementia. For dementia assessment, various cognitive assessment tools are available, and they are beneficial to identify the disease maybe on early stage or possibly moderate stage. For example, there is a 10-point cognitive screener, 10 to CS, and also there is other type of cognitive test assessment, which can be include three temporal orientation question, for example, asking years, month, and date, and the three-word recall that, and a 4-point scale animal naming task, which can be beneficial to understand, diagnose the person is involved with dementia or not. Also, 6-item cognitive impairment test is other cognitive assessment which is beneficial for identifying and diagnosing dementia. The 6 CIT consists of 6 questions, include temporal orientation, remembering and addressing and counting back from 20 and stating that month of the year in reverse. Also, mini cognitive assessment is other type of test which is beneficial to understand the person cognitive ability with dementia. The mini cognitive test consists of 2 components, a 3 items recall test for memory and the clock drawing test. Also, blood test to check for other condition can be very helpful to understand dementia sign and symptoms and diagnose that. For example, your GP can arrange for you a blood test to help to understand cause and symptoms of dementia, which can be mixed up with other disease, in most cases liver function or kidney function or thyroid function. Laboratory tests such as a MRI scan can help to diagnose dementia, different type of dementia, and what exactly caused the dementia. For example, provide detailed information about the blood vessel damage which happening in dementia or vascular dementia brain, and also a shrinkage of brain in some part of brain which also occurring in dementia brain, such as frontal and temporal lobes are which affecting by a shrinkage in frontal temporal dementia can be identified via laboratory tests. Also, other laboratory tests such as a CT scan can be used to check a sign of a stroke or brain tumor, but it can't provide the detailed information about structure of the brain. Thank you for watching and listening my video. I hope you enjoyed that. If you like it, just share it with your friends, subscribe it. Have a great day. Goodbye.